Hello? Hello, Carolyn. Yes, I am ready now. Do you want to come up? You know, I'm on the 5th floor. Bye. Hello, Carolyn.
Clinical supervision is a formal technique for professional development and may be useful to you in running your nurse-led clinic. Many nurses, in differing areas of practice, put themselves in a supervisory relationship with the aim of enhancing their practice. Supervisor and supervisee need to understand how the technique works, and books, articles, and workshops are available. Clinical supervision is generally regarded as being patient-focused and a method to facilitate reflection on practice. The supervisor is someone that has an expertise or proficiency in the approach, facilitating reflection and helping the supervisee to come up with answers to their practice issues instead of offering their own advice.
Hello, Carolyn. Nice to see you again. I just want to remind you about the ground rules as I do each time. As you know, it's to do with confidentiality. So basically, anything that we say in this room stays in the room. Okay?
Thank you.
Okay. Now, the last time we met, you went away with an action plan as the result of your last clinical supervision. Can you tell me how that went?
Well, thank you for talking things through last time, and I've sort of now, when I come to clinic and I know that I'm going to expect sort of some chaos and disorganisation, I sort of remember that although I may not be calm inside, it's important to present that calm persona on the outside. And so when I walk into clinic, and I just try to deal with things in a organised way, deal with the running order of the patients, and not allow myself to be sidetracked by kind of more nebulous issues, but just to focus calmly on the job at hand.
So it sounds as though your action plan was effective. That's good. What have you brought to discuss at this session?
I met a gentleman in clinic 2 to 3 weeks ago who's a taxi driver for a living, and who needs to be brought in for some investigations and a heart biopsy. And at the beginning of the consultation, he was a bit anxious, and he asked me quite early on if we could possibly reschedule the admission until the end of the summer. And as a professional driver, he'd been unwell for some months, and he'd just got his licence back, and he'd been having some quite severe financial difficulties. And he felt that if he could work his way through the summer, then he would be in a much better situation in the autumn financially. And while he was with me, I rang his specialist nurse to discuss with her, and she said that she would take it to the consultant who was going to admit the patient for the investigations. I left it with them to discuss with the patient. They were responsible for managing his care, and I believe they spoke to him, the nurse and the consultant. And then shortly before the gentleman was due to come in, I actually received a letter from the consultant, the tone of which was a little abrupt, and appeared to be kind of questioning my involvement in sort of asking to have the patient's admission date, or suggesting that would it be possible to have the admission date rescheduled. And it just left me with a kind of feeling of what should I have done? Should I have asked or not asked? And I felt that I was asking on the patient's behalf, and the patient said that he would be guided by our decision, and I didn't have enough knowledge about the patient's history and background to give the patient the right answer myself. So I went to the people that I felt would.
So was it the letter from the consultant?
Coming back to it, I think it was. Obviously, I was concerned for the patient's welfare, that he didn't come in on the day he was due to come in. But the tone of the letter was a little bit sharp, and it made me question whether or not I should have intervened or got involved with the decision about the admission at all.
So is it unfinished business?
It is unresolved. I'm not sure whether I should discuss it with the consultant. I think I will probably just take it to a specialist nurse and see what she thinks about the matter. But I felt I was, acting on a simple request from a patient to reschedule if it was appropriate, and that we would be guided by their advice.
We asked English nurse consultant Philomena Corrigan about the advantages of clinical supervision.
I think one of the advantages is that it gives the nurse a safe space to be heard and also to hear his or her own voice. There's something about saying things aloud that makes a difference to how we think about them. The role of the facilitator is not to give advice to the supervisee, but instead to help him or her think through what the problem is and then come up with an action plan. So I think it gives that person some time out in a quiet environment to really think through something that they're not able to work through just by themselves. What effect does it have in the long run? Well, I think that it improves care, like all of these things. Because if the nurse is able to have that time to reflect with somebody who is skilled at helping him or her to reflect, they're able to go away and deal with whatever the situation was they brought to reflection more effectively.